Hi everyone, I'm Dr. Moran. I'm a veterinarian with a bit of a public health background. Today is April 9th, 2020, and we are in the middle of the COVID-19 pandemic. My friends at the Needy Claws Rescue in the Indianapolis area asked me to put together a little video about COVID and animals, so I hope this helps. So what is COVID? COVID-19 is the disease that can result from a human infection with SARS coronavirus 2. The theory is that the virus came from bats and was transmitted to people at a live animal market in China in late 2019. Right now, again, as of April 9th, 2020, it infects people. The main method of transmission for the SARS coronavirus 2 is air droplets. The way this works is somebody that is infected, whether they know it or not, they cough or sneeze within 3 feet of an uninfected person. Those virus particles are in air droplets or droplets within the air that travel. They can travel that 3 feet and make it into the other person's respiratory tract, whether nose, mouth, or eyes. Another method is fomites, use of fomites. So an inanimate object is a fomite. An example of this is an infected person coughs or sneezes into their hand. They get virus particles in their hand. They go to touch, say, a doorknob, and then the virus particles are on the inanimate object, the doorknob. Next person comes along, touches the doorknob, gets it on their hands, and then itches or touches their face. The virus will make it into their respiratory tract that way through the mucous membranes in either the eyes, nose, or mouth. Another possibility is a fecal-oral transmission. There is some evidence that people can shed the coronavirus in their stool. This would happen, you go to the bathroom, someone gets feces on their hand, they touch things, they're just not quite as clean as they could be, and then the next person gets it on their hands, they touch their mouth or face, and that's how they can get infected. So wash your hands, please. And then the last method is airborne. Now there's not a whole lot of great research out there to prove that the virus can travel long distances in the air. The research just isn't, it's not conclusive at this point. There are possibilities that in the right environment, it could be aerosolized and travel long distances, but it's just really not known that well right now. Reports of COVID in animals. There have been 2 in cats that I know of. So there's one report in Belgium of a house cat testing positive for COVID and having similar signs that people have with respiratory issues, fever. And then there was one tiger in New York at a zoo that tested positive as well. Now this is not normal. This is not common. The CDC has had no reports of other people that come in contact with their pets on a daily basis that have become or tested positive and had similar signs at home. So this should not be a big concern. This is just, these 2 are outliers. These are weird and it's not common at all. So animal interactions, if you have COVID, the USDA recommends restricting contact with animals. We don't know enough about pets acting as fomites for people. So if you can't avoid contact with your pets or other animals, wear a mask, wash your hands frequently, just like you would help to prevent the spread to someone else in your house. To date, the CDC has not received any reports of pets developing COVID in the United States, only the one tiger in the Bronx Zoo, which is, like I said, a definite outlier.